Hello everyone, and welcome to the True Holistic Fertility Care webinar. Apologies for starting a few minutes late. We had lots of testing and checking before we got started to make sure that you could see and hear us all perfectly well. So hopefully you can. Thank you so much for joining us this evening. We're really excited to be bringing this unique webinar to all of you. My name is Sarah Holland and I'm hosting this evening along with an amazing team. And we're going to be sharing with you a truly integrated and holistic approach to fertility with a team that I don't think you will have ever met before, bringing together the medical and the natural world all in one place. We believe this is the best approach to fertility support, to bring everything together under one roof to give you the best chance of a successful conception and birth of your baby. Now, I'll just quickly run through who we have on the team with us. First of all, we have Dr. Elias Zakos. He is the Fertility Specialist Medical Director at Embryo Clinic in Greece. We also have Rosie Letts, who is a fertility, pregnancy and integrated women health expert and nutritional therapist. Claire Spink, who is the founder of Fertility Massage Therapy and Training. Gordana Petrovic, a fertility acupuncture specialist. Myself, Sarah Holland, who's a fertility EFT and mindset coach. And lastly, Dr. Kannelina Bimper, who is a certified surgeon, and alongside with Dr. Sakos, she is the founder of the AlphaZita team and the Holistic Fertility Retreat in Greece, which is what has brought us all together with you today. We wouldn't be here without the two of them. So thank you very much for creating AlphaZita. Unfortunately, as billed, David Gibbon was due to be joining us today, but he had some unexpected family commitments, so wasn't unable to join us. However, we do still have a huge amount that we're going to share with you, and we hope you really enjoy everything that we're sharing and that it's truly useful for you on your fertility journey. So first of all, before we begin and get into all our specialist topics, Dr. Sakos, could you begin by just giving us a brief introduction as to why it's important to look at fertility holistically and how it can really improve the outcome and why we're here?
Hello, everybody. Hello, Sarah. Hello, Rosie, Gordana, Claire, Kannelina. It's a great honor and pleasure to be with you tonight. And thank you all of you who's spending all this time with us tonight in a late evening. Holistic fertility care. Is there another way? I have been a fertility specialist. I've been in the fertility field for 27 years. And up until a few years ago, I've always felt that there was something missing. The technical and the medical aspect of medicine and science has developed over the years, has reached a very high level of safety and success. However, I've always felt, and I'm sure that most of my colleagues have felt the same, that there was something missing. And what was missing was addressing the need to include in our team fertility specialists, people like yourselves. What was missing was the fact that we only dealt with the physical and the medical aspect of our patient care. And when it came to other aspects like nutrition or diet, we would say, well, I'm sorry, you need to see a nutritionist, but we wouldn't suggest anyone, or we didn't have the opportunity to do so. Or when somebody was overstressed or somebody was facing family problems or failure problems, we didn't have very many options to either refer them to somebody to set their mind at a different level or to address the stress levels. So as far as we're concerned, holistic is the natural evolution of fertility care, which was wrongly, in my opinion, just in the hands of the medicine, the medicals and the scientists. And now it's time to include a multidisciplinary approach, and an approach that includes the rest of the body. So the body we should be treating is not just the uterus, the ovaries, and the sperm. There's more to a human body than that. And of course, the mind and the soul. Now, how does it improve the outcome? I could lecture for days on that. In 4 or 5 minutes, I can easily say that it depends on the definition of outcome. What is successful outcome of a fertility journey? Is it a pregnancy? Is it a healthy pregnancy? Is it a healthy and pleasant pregnancy? Is it an uncomplicated pregnancy? Is it a normal childbirth or an uncomplicated childbirth? And how about the long-term effects of the fertility journey on the mind, body, and soul of the lady, of the couple, of the husband? How about the outcome of the child? So how about the long-term outcome of the child, the developmental outcomes following that difficult journey? So I think it depends on how we define outcome. Most people, and most of us in the past, we used to define successful outcome, success of treatment. And most of us didn't even have the opportunity to follow on the pregnancies and be aware of what went on in this pregnancy beyond the conception. So holistic approach to improving outcome is more than that, is defining a successful outcome the fact that we would optimize that journey, we would make that journey as safe, as successful, and as a good experience as possible for the couple. We should perhaps keep in mind that the commonest complication of fertility treatment is failure. We should be prepared ourselves, and we should be preparing our couples for that. We should have the system to organize and pick up the pieces of those couples who eventually fail, and there's a good number of them who will. Even couples who are successful after a very difficult journey, they may face personal, physical, and emotional problems that we should be addressing. So overall, it is important to address all of that. It is important for us medics to stop being too medical and too technical, and to be aware that we're treating individual patients with individual needs, which are not just medical, they're emotional, and we should ensure that we optimize our treatment and we prepare those couples, those singles, those patients, those individuals for a journey with one aim, the aim to be a good experience, to be a fulfilling experience, which is what we should be centered at.
How refreshing is that to listen to? And I'm sure all our attendees this evening are breathing a sigh of relief, hearing, how the medical world can be expansive in this way. And I loved how you started by saying, is there another way other than being holistic, and it's great to know that's your way of operating. And I think it's how most of us here like to look at fertility, and it's wonderful to be able to introduce that to the wider world now and show that it is possible to work truly holistically and what it really means, and that the whole patient journey, like you said, even beyond a successful outcome, even it's important to still keep that level of care there. So thank you for introducing our topic so wonderfully. We're moving on to Rosie now. Rosie Letts, could you tell us a little bit about your approach to fertility care? How do you approach holistic fertility care?
Of course. Thank you, Sarah. And hello, everyone. Welcome. So my role really as a nutritional therapist and as the AlphaZita nutrition specialist is to empower couples to take control of their fertility journey through nutrition and through lifestyle management. I believe that food is really one of the most important ingredients in your holistic fertility plan. I believe that because we are made cell by cell from everything that we eat or drink. And that's why it's just always made so much sense to me that what we put into our bodies affects us in every way. We know that both the male and the female reproductive systems require specific nutrients and specific nutrient balances in order to function at their optimum. And so we have the ability to affect this through diet. And when it comes to your fertility, this really allows you to take an active role in the treatment. And I really believe that you should do that. So the optimum fertility diet is actually really quite different to what people often perceive a healthy diet to be. So very, very often when I start working with a couple, I'll ask them about their nutrition and they'll tell me that they believe they eat really healthily. And it's only when I kind of start to investigate that I realize they do eat healthily. They've been on lots of diets and they've understood how to keep their weight down. But the way that they're eating isn't necessarily optimum for fertility at all. So I guess my role is primarily to educate my patients so that they can understand what they can be doing every day to optimize their fertility, and then to provide the tools in order to make that easy, because it's very overwhelming to suddenly hear that you've got to change lots of things, and food's so personal. So it's really important to have the tools and the resources and to make that change easy and enjoyable. So my approach, first of all, involves optimizing diets to correct any nutrient deficiencies. When we're deficient in certain nutrients, imbalances in egg and sperm health can occur, and we know that correcting these deficiencies improves success rates both in natural conception and assisted conception. So the key deficiencies that I commonly look for right away are things like vitamin D. So 4 in 5 adults in the UK are deficient in vitamin D, which is linked with unexplained infertility in both men and women. Also, folate, calcium and iron. Insufficiency in these micronutrients is linked with annual ovulation and also with premature miscarriage as well. And then there's zinc. 1 in 5 men in the UK are deficient, and zinc plays a really crucial role in sperm health. So identifying and correcting deficiencies is important. And then I try to support women to improve the quality of their eggs. Now, many people don't think that's possible. Many women have actually been told that there's nothing that they can do to improve the quality of their eggs. Whilst it's true you're born with all the eggs you're ever going to have, it's not true that you can't affect the quality, and it's certainly not true that you can't affect the environment in which your eggs mature, which is just so important. So it takes roughly 150 days for eggs to mature within their follicles. And so if you start working on improving your nutrition today, you can have a really profound impact on the quality of your eggs in around 4 months from now. So I thought I'd share with you a few kind of tips on what your eggs need and how you can start that process. So first of all, plenty of low GI carbohydrates, and particularly a low GI carbohydrate called inositol, which we know has a really dramatic impact on egg health. It's like a fuel for the eggs. Healthy fats, so omega-3s and polyunsaturated fats. Most of our diets are really chronically low in these nutrients, so building those up to healthy levels through oily fish, nuts and seeds. Getting enough protein. Protein's the building blocks of our all of our body tissues, and that includes all of our reproductive organs as well. And when we're making a baby, we need loads and loads of protein. And then our antioxidants. So antioxidants combat free radical damage in the body, and so much of unexplained infertility seems to come down to inflammation somewhere. In fact, you could argue that actually all chronic disease really comes down to inflammation somewhere in the body. So if we can use food, colourful fruit and vegetables, herbs to combat that inflammation, that's a really positive step that we can take straight away. The nutritional approach is actually really effective at improving sperm count and sperm quality. If you imagine sperm are manufactured all the time, it's a constant process of manufacturing sperm, and so they really draw from our nutrient reserves, and the diet that we're eating kind of really impacts the way that sperm are developing in real time. So the right balance of nutrients and the right balance of antioxidants are proven to reduce the number of abnormal sperm in samples and also improve their swimming ability as well. So top tips to improve sperm health: getting enough vitamin C, which is a powerful antioxidant, and CoQ10. This is known to improve sperm morphology. That's one of the biggest reasons that couples come to see me, is because their sperm morphology is bad. So looking at any brightly coloured fruit and vegetable for vitamin C, and for CoQ10, we're looking at oily fish, shellfish in particular, chicken, nuts, certain nuts. Vitamin E is really proven to reduce chromosomal damage within the sperm, and also it improves, because of the way that it strengthens the sperm, it can improve their ability to penetrate. So obviously vitally important. It's another common deficiency. And then we've got certain key amino acids which people tend to have imbalances in. And I'll kind of go into that in more detail on the retreat, of course. And then there's certain foods that just really act to disrupt our efforts. Certain foods that should really be completely avoided. But often the information is not really there and couples aren't really sure of exactly what to do. So alcohol is a big one, which people probably are aware of. Caffeine. A huge study found that women consuming 5 cups of coffee during their IVF treatment were half as likely to become pregnant. And 5 cups of coffee, that's not even really all that much. It's probably, I don't know if that's even a can of Diet Coke. Low fat and no fat foods. So when I was talking about how fertility diets aren't necessarily the diets that you perceive to be effective, so many couples that I work with, particularly women, have been doing Slimming World or Weight Watchers for years and years, and they're very ingrained in this mentality that our diet should be low fat. And actually for fertility, the essential fats in our foods are of vital importance. And the simple fact is that if we don't get the fats, we don't get the fat-soluble vitamins. That's the vitamin E, that's the vitamin D, that's the vitamin K, all the things I've been talking about. So low-fat foods really don't work for fertility at all. So I hope that gives you a kind of a little snapshot into my world and into what I do. For me, it's just so important to educate, to try and make this enjoyable, because I'm a real foodie and I believe you should be as well. But also to kind of try not to think of nutrition as another thing that you have to do. Don't let it bring you down, but nutrition should be a way that you can really feel empowered on your fertility journey, because every single day, every time you eat or drink, you have the ability to create positive change, improve your chances of success, and not just for conception, but for a healthy pregnancy and for a healthy life as well. So that's me.
Thank you, Rosie. I love how many actual real tips you gave then, and I can imagine people have been writing everything down. Yeah. Start giving the information. It's wonderful. And also that you included at the end that it should be enjoyable. You know, just because you're following certain guidelines to change your diet doesn't mean it has to be boring, does it? You know, it can still be very, and even more interesting, because you're eating in new and exciting ways, and it's feeding your body and restoring your health. So yeah, with the right mindset, which is what I'm going to talk about, I know that it can be really, a positive experience changing your eating habits. So thank you for sharing all that information. That was wonderful. Claire, we're moving over to you. I've worked alongside Claire for many years, and I always enjoy hearing Claire speak. I'd love to hear today about your approach to holistic fertility care and what that means, Claire.
Thank you, Sarah. Well, fertility massage is something that I created to help women through all phases of their menstrual cycle. And it just happened that every client that I started to work with in the early days were having babies. So it became a fertility massage. So my approach is that we're working on the mind, the body, and the spirit. And it's the hands-on approach to fertility. So the massage itself, we're working on the lower back, working through the nerves that feed through all of the lower back and the sacrum that feed into the digestive system and the reproductive system. So I'm holding that cough back not to disturb Rosie. So sorry. And we have several points on the back that can also not only work on the nerve system, but there's acupuncture points, which Gordana will talk about. But there's points that we specifically work on that are to do with releasing grief, releasing onto areas of tension that we're holding on to, and not just looking at just the physical but working on what we can do to work on the body to help release the emotions that we're holding in the body. And then when we turn them over and we work from the pubic bone up to the rib cage, we're working through the whole of the digestive system. So this is where my work really works with Rosie's, in that by working the digestive system, we're helping to break down hard-on feces, get the feces moving through the digestive system, because if it's sluggish, they can't take on the nutrients, and they're just holding on to that toxicity in their body. But also physically, we don't want to be bloated. We don't want to be holding on to all those toxins. But also we hold a lot of emotions in our digestive system. And then we come down to the lower part of the abdomen, where I'm working over the womb, the ovaries, the fallopian tube. And we are aiming to get as much circulation down into that area as possible. We have 5% blood flow that gets into our reproductive system. But if we've got any congestion, if we're tight through our diaphragm and we're not able to breathe fully all the way down into our abdomen, or if we're constipated, we've got those blocks and they're stopping the blood flow from getting down into the womb. And we need that blood flow. That blood flow, it clears away toxicity. It brings nutrients, hormones, and fresh oxygen. So we need to physically work on improving the circulation throughout the whole of the abdominal area. We're also looking at trying to relieve some of the tension that physically the womb holds. We have a very important muscle that connects the torso to the top of the legs called the psoas muscle. And this muscle runs either side of the womb. And when the psoas goes into fear, it's like a caterpillar. It will clench up and tighten the body. And the psoas was the first muscle that was going to develop inside our mother's womb. It's the muscle that holds on to all of the fear that your mother may have had when you're inside her womb. So if we come out of our mum's womb with a lot of fear, then our psoas is tight, and that restricts the functioning of the movement of the womb, the ovaries, inside our pelvis. But then also, as we go through fertility journeys, as we go through life, we have fear that kicks in, and it will tense up and restrict the movement, the blood flow to our womb area. So we are working physically on trying to release that tension that we're holding. But my role as a fertility massage therapist is to be like a detective and find out what is that emotion, what is it they're holding on to, how can we release that? And sometimes it's ancestral stories that we hold on to. Sometimes it's things from our childhood. We don't always need to pinpoint exactly what it is. But the good thing about working with a team like this is that when things do arise, I often suggest that they then go and see my friend Sarah and tap it out and try and release that emotion. So Dr. Wilhelm Reich, he created the term emotional armoring, and that's really where my work comes in, is that the physical that we hold on to, we store in our body, we store in our cells. We need to get to the bottom of it and help to release it. And when you are being massaged and you're in a relaxed state, you allow those emotions to rise up. And a lot of the time we do see releases, we do see tears, we see laughter, but it's a way of clearing those emotions from the body. And we also need to look at the spiritual, about calling in our babies, our soul babies. On the last retreat, I had a really beautiful moment with a couple where I did a welcoming of their baby ceremony. And so ceremonies are also part of the work that we do. Fertility massage is a lot more than just lying on a bed and having a spa treatment. I get very upset when people say it's a spa treatment. It's an honouring of the woman. Yes, it can be the man as well, but very rarely do I get the man to lie on the bed. But it's an honouring of them, it's an empowering them, it's allowing them to create and find their creativity and allow everything with them to rise up. And that creativity may be a baby, it may be whatever their creative juice is that needs to rise up. And I know that I've trained somebody who works at the embryo clinic in Greece, and she's given fertility massages to a lot of the clients over there, and the results have been wonderful, because it's not just, as Dr. Elias said, it's not just getting people pregnant, it's the whole journey, it's the experience that those women feel. And part of our treatment is wrapping women in cloths, and we call it a restoring of the soul ceremony, because every time we go through emotional trauma, we shatter a little part of our soul, we disconnect. And so our role is to bring them back into their bodies and to make them feel whole and connected. So that's fertility massage, kind of in a nutshell. I've probably gone off on a tangent, but that's quite normal for me, isn't it, Sarah?
I'm impressed you kept to such a short speech, but can I just say, oh my goodness, from so much experience of working with you, Claire, both obviously we have our joint clients, but also firsthand, I've been lucky enough to experience your massage, I think 3 times now, yeah. 3 amazing times. And it is, you're right, so much more than a massage. It kind of, the name doesn't do it justice. And it's, the whole emotional, spiritual, physical piece. So I think it's wonderful that you are included in an integrated team in this way, and your therapies are included, and the ceremonies and that side of it. I think that's often missing when you look at the mind and the body. Often that extra spiritual perspective isn't included. So it's great that you're here as well. Thank you so much. That was really interesting. Thank you. We are going to move on to Gordana now, talking to us about acupuncture and everything that she specializes in. So could you tell us, Gordana, a little bit about your approach and what makes it so unique?
Well, good evening, everybody. It's a real great pleasure to be here. First of all, in this amazing team, it's been a dream of mine to work as part of the holistic team ever since I graduated about 10 years ago. And then, of course, welcome to everybody joining us to find out how we do it, what we do, why we do it. And we've had so many wonderful speakers thus far. As far as acupuncture goes, acupuncture is a very old medicine model, and it's holistic in its own nature, because it always looks into a person as a whole. So it's never just that an acupuncturist and myself look into how the body works, but it's also how the mind works and what the connection really is between the two, and how both are impacting one another. In terms of the holistic fertility care, that's no different as if in any other aspect of medical or complementary medical care. Fertility acupuncture is specific in as much as it's a very multi-layered and I can't say complicated, but a complex journey that I travel with my patients with. Very often I have clients that are coming in as a last resort because they've tried everything else, either via natural conception, through natural conception, or via IVF. And then when nothing else has worked, they would be referred to an acupuncturist, which is a shame. But even then, we do a lot of work, and my particular success rate is really quite high. It's above 80% of not just a conception but live birth as well. So what is really acupuncture? It's part of the traditional Chinese medicine, one of the techniques, one of the biggest modalities, and it includes inserting very fine, hair fine needles into certain acupoints on the body. Claire has mentioned that she does work with some acupuncture points, and then you'll be hard pressed to find a point on the body which is not an actual acupuncture point. The real art or science, depends how you want to view it, of acupuncture is how to combine them and actually make a right prescription in inverted commas for each person, and I'll explain why. Every single patient that comes to the door is viewed individually. So not only holistically, obviously, I mentioned that's the case, but it's individually. So from the moment they walk through the door, the way they sit down and the way we relate, I'm starting already to make a diagnosis of what I think might be an obstacle in their fertility, in health. So it's looking into obviously medical history, then looking into their lifestyle, diet, patterns of sleep, and all the other very important bodily and mindly functions, and then coming up with a prescription, again in inverted commas, in a sort of a recipe for this person and this person only. there are some protocolar things which are assisting patients on the IVF route and performed on site in IVF clinics with good results. But the best thing is really to come up with the actual prescription that would fit the actual person. So that in itself is very holistic, because everybody is different, and we have to find out what works for one person and what doesn't work for that person, and how to get them there. So that's a little bit about acupuncture. In terms of what acupuncture can help, or often when I'm asked, what is it good for? What does it work on? It really doesn't work on anything. It works on a person. It works for a person. Again, bringing back to what I've just said, it's always a therapeutic method for a person and not for their symptoms. Obviously, when we found out a pattern of disharmony in everybody, we will obviously have a resolution of the symptoms as well, but we have to treat the cause rather than effect on its own. I often see people coming in with PCOS, so polycystic ovarian syndrome, tubal factor, blocked tubes, fallopian tubes, uterine tumors, or any dysfunctions in the menstrual cycle, long cycle, short cycle, amenorrhea, dysmenorrhea, painful menstruations or absence of menstruation, and impaired ovulation. All of these, so to speak, conditions or situations can be dealt with really, really well with acupuncture and regular treatment, which would possibly include moxibustion or maybe some light massage as part of the treatment of either a woman or men and women, and couples very often do come in now more and more, because lately it has been proven that around 40% of fertility issues is actually now assigned to men. So it's very important to actually look into the familial situation as well within the couple and see what can be done. So these are the most common issues that I deal with pretty successfully. Acupuncture is not a one-off treatment. It usually requires at least a course of treatments between 5 and 10, depending obviously what we want to do. And again, it's individual for every couple or a single person wanting to conceive. And the fact that I actually have a backing of a medical team is pretty amazing. I mean, it's proven as an incredible ally for me, and also working with other people that I can cross-refer with. So not just stick needles in people, but refer them for a body work, refer them to a medical specialist to look into their medical results, read them for them. It's an amazing opportunity to really give the best to all our patients. It's the most powerful thing ever, and I always known that this is the route I want to take. I didn't know that I would be a fertility acupuncturist, so to speak. But I thought, wouldn't that be nice if we can all pull on our own individual amazing qualities and then work together on the same wavelength for the best of our patients. And this is what's happening in AlphaZita, and acupuncture is a big part, and I'm extremely happy to be able to contribute that way. So it's not, as I said, not one-off treatment. And also I have to say, it's not about the needles being really, really painful and really, really horrendous. So you can expect to have some sort of a sensation if you're coming in for the first time, because if there is no sensation, there is nothing happening. So we have to get something. But the pain, as you would be expecting from a drawing blood or whatever, is not happening. And I'm hoping some of my patients are listening in and nodding, hopefully, or saying, yeah, right, whatever. It's easy for you to say it's not hurting, but it really isn't. It's a different sensation we are looking for, and the sense of relaxation and stress relief afterwards, and a relief generally, is very often on cards, and it helps a lot. So that's an added bonus, not just resolving medical conditions, but really working on stress levels, regulating the hormones, providing a good night's sleep. I mean, I can't think of anything that acupuncture can't help, and certainly on a fertility journey. what Dr. Sakos was talking previously, it's very, very important to actually have that experience that is very good, because none of us can really guarantee the results, really, with all the best we do, but we can guarantee the experience. And I know for each one of us in the team, we can guarantee the experience. And this is partly how AlphaZita was contrived to provide this experience and to let everyone know that they are backed up. We are all doing our best. We are there for them, and we can do a lot. We might not be doing everything at the same time, that the patient wants to, but we usually get there one way or the other. And acupuncture, my tool, acupuncture is pretty amazing. But then I'm biased, you have to say, because I'm just so passionate. I love it. I have it myself. I do it myself on myself, and whenever I have a chance, I'll do it on anyone who wants to try, free of charge, paid, whatever. I'm that passionate because I know how it works, and it's a privilege to be part of this team. It's a true pleasure and privilege. So that's from me.
Thank you.
Hopefully,
Gordana.
within the time.
Yes, you're perfectly in time. Wonderful.
Cool.
And I think we can hear your passion. And whilst we can't hear from your patients that are listening in and saying, no, it's not painful, I can vouch for it. I had 3 months of almost weekly acupuncture leading up to the conception of my baby, and then through pregnancy as well and beyond. And I think there were a couple of times when it was a little bit tender, I would say, but
yes,
not painful. And that's from someone who used to be needle phobic, had this amount of acupuncture. So I can say it's definitely okay. Thank you. And thank you for sharing how the integration of the team works, which I think is becoming clear as you hear us all speak, and how we all work with each other and can refer to each other. And I think each of us are very passionate about our own approaches and get great success rates alone. So then how amazingly powerful it becomes when you make a prescriptive kind of approach, taking in all these different modalities together, along with any necessary medical treatment as well. It's phenomenal. And like you, I feel very privileged to be working among such a wonderful team. So thank you very much.
Thank you.
And I'm eating into my own time already, because now it's my time to talk a little bit about what I do. As an EFT and mindset coach, I offer the whole emotional piece of support within the AlphaZita team. And that complements, I would say, every single area, whether that is going through medical treatment or taking on other natural therapies. The mindset is important, and I think it is often ignored. In fact, I would say the first time that most people come to see me and seek out emotional support is when they're feeling completely overwhelmed, very stressed, and they may also feel like they've got to a point on their fertility journey where they can't actually imagine carrying on trying. They can't face, for example, another IVF cycle or anymore, going past another milestone like another birthday. It's getting to that point of I need support or I can't carry on. So that's often the first reason that people seek out emotional support. And of course, it's a very important reason. It's important to have that support to continue on your journey for as long as you want to or need to. And also to make that experience of trying for your baby not only a comfortable experience, but also maybe even enjoyable. Bring back some of that excitement that you first felt when you decided that you wanted to try for a baby, and remove the stress and the anxiety that isn't contributing in any way whatsoever. And I believe that everyone on a fertility journey deserves this, and that looking after emotional and mental health and well-being now is going to prepare you also for the next stages of pregnancy and of parenthood, and all the challenges and life changes that brings. You're putting yourself in a really strong place by taking care of your emotional well-being now in this preconception time. So whilst people come to me often for that initial stress, the very obvious stress and overwhelm, there is so much more to the emotional aspects of fertility. I could talk, I think it was Dr. Sakos who said he could talk for hours, and I could definitely talk for hours as well. I think all of us could, so we all need to have our timing today to keep on track. But yeah, for every single person that I've worked with, it's a unique story and unique needs that they all have for the emotional aspects of their own fertility journey, and the way their life is impacted and the way their life is impacting on their fertility also. It's like a two-way street. And also for some people, it is the missing piece of the puzzle. Taking care of that emotional side is the thing that makes everything else fall together, and then they're able to conceive and have a healthy baby. I often see people who are trying to do everything to support themselves physically, both medically and naturally, with diet and nutrition and fertility treatment, and they feel like they've got every aspect physically covered, and perhaps their test results and their hormone balance is coming back looking amazing, and there is no obvious reason why they're not getting pregnant. They're often put into that frustrating category of unexplained infertility, and I believe that makes up anywhere between 25 and 30% of people who have fertility issues are under that unexplained category. So I'm sure many of you listening this evening can relate to that kind of frustrating, I call it a non-diagnosis of unexplained infertility, because it's not really giving you anything to work with. But there is obviously something still that is out of balance and that needs support. So in those situations, and actually many of the people that come to see me often like to look into emotional or physical blocks to conception. And I often talk about it as being potential emotional or physical blocks to conception, because we don't know whether they're there. You know, there's no diagnostic tests to do with that, is there? You know, there's nothing that we can test to check if these blocks are present. However, a lot of people have a kind of intuition or a deep knowing that something that either has happened recently on their fertility journey, or a mindset or a belief or a perspective they have about their fertility journey and becoming a parent, or maybe something way back from their past is impacting potentially on their ability to conceive. I often ask people to look at issues around safety and fear, and ask yourself, do I feel comfortable being pregnant? Do I feel comfortable imagining that experience? Do I feel comfortable with the idea of giving birth? For many people, that is something that fills them with a great deal of anxiety, especially when they've heard from friends and other people who have been through childbirth and share their kind of horror stories, you know, of what went wrong. No one seems to talk about the good times, you know, and the way that their body worked naturally with childbirth. So we gather a lot as we go through life, and definitely on a fertility journey as well, a lot of other people's stories and other people's beliefs, and that can lead to potential safety and fears around going into this step. So just using a kind of a method of visualization can be really useful to identify, how do I feel about each stage, right from seeing that initial positive pregnancy test all the way through the journey, right to parenting a growing child and even parenting an adult, you know, knowing life is forever changed, and seeing how that feels on each step of that journey. And if there's anything that feels blocked or scary, or you just can't imagine, then that's what I like to delve into with my clients to explore and see if we can resolve, so they feel freer towards going into that step of their journey and feeling comfortable with becoming a parent. This can kind of sound a little bit less tangible, you know, it's the kind of stuff that's going on in our subconscious, but also we may notice how these blocks are impacting on us every day. You know, we may notice that we're sabotaging our best efforts to get pregnant, or we're actually feeling conflicting thoughts in our mind of, I definitely do want to get pregnant, but at the same time I have a lot of fear and anxiety around it. So it can feel like we're sending confusing messages to our body as to whether it feels safe and comfortable to get pregnant. So what I tend to focus on overall, of course there's so much that we can focus on, but is releasing any unwanted or unneeded negative thoughts, feelings, beliefs, anything that isn't needed to support your fertility, and help clear that path between you and your baby, making it easier to carry on for as long as you need to on your fertility journey, pursue any treatment, whatever you need to do, and also be open to all possible solutions. I find that when people have really good quality emotional support, they feel much more creative and resourceful, and they're open to lots of different solutions, whereas previously they might have felt like they were it had to happen one particular way because that's how they imagined they would get pregnant. They then become more expansive and more open to different solutions, which is often can lead to a more positive outcome. Now, the tool that I use to do this, because all of this sounds very good, you know, great to be able to release everything that we don't need, but how can we do that? We know it's impossible to just tell ourselves to relax and tell ourselves to stop feeling anxious, for example. But I use a technique called EFT, stands for Emotional Freedom Techniques. Sometimes is also just called tapping, because it uses a tapping technique like this on the Chinese meridian points. And it's a technique that works very quickly and easily. It's extremely effective. And like Gordana was talking about the meridians, and also Claire, we all work in such similar ways, but we're using just a tapping technique here without the needles. And it's something that you can use yourself to rebalance your emotions. And you can also use it in a therapeutic situation, one-to-one with someone like myself. People tell me that EFT feels like magic when they see how quickly and effectively it works, because really what it's doing is helping you release anything that you don't need and helping you get back in touch with your most natural and healthy mindset and the best emotional state for you to be in as you're facing this next step on your fertility journey. Once you've learned it, whether that is one-to-one or whether you learn it through self-help techniques or in a workshop or wherever you learn it, you can use it then by yourself whenever you need to as well for general kind of day-to-day stress management. The deeper kind of exploring emotional blocks would be usually done more in a therapeutic one-to-one session, but it is such a wonderful tool to have by your side, to use often as well through fertility treatment, through IVF before appointments and procedures, especially embryo transfer or during the 2-week wait when you're driving yourself crazy with analysing symptoms and wondering if you're pregnant. If you have a tool literally at your fingertips you can use, it's very useful and extremely calming. So that's why I am very passionate about EFT. I could carry on, but we have lots to fit in and talk to you about. So I will pass you over to Dr. Sakos now, who is going to talk to us further about your approach to fertility. I'd love to hear a bit more about how you work, Dr. Sakos.
Yes, thank you, Sarah. I mean, it was wonderful listening to you. And well, many times in my career, I left helpless because I felt helpless because there was a mishap happening to our patients. And there's somebody now listening live who had a mishap, which is a stillbirth. And as a physician, as a doctor, you can spend 20 minutes, half an hour with this couple, with this lady. You can say how sorry you are, but effectively you can't offer them any help. So it's really a relief to know that there are people out there to help, emotionally, spiritually, and to support them also in every aspect of that difficult journey. So the approach to fertility, as far as I'm concerned, my team, is very simple. It starts with fertility awareness. It's amazing how little people know about fertility. It's amazing how little people are educated about fertility. Take the age factor. After 40, the chance of a spontaneous healthy pregnancy is very small. How many people know 45? The possibility of an assisted IVF pregnancy with somebody's own eggs is still extremely small. But on the other hand, how many people do know that, at least in Europe, with a regulation that's is valid at the moment, anyone up to the age of 50 can have a child as long as they're prepared to take a journey and to do whatever it takes for that journey. We have been speaking many times in conferences and in other activities, saying that really it can be a guarantee for a pregnancy as long as someone is prepared to do what it takes. What are the factors of infertility? Male factor, fine, we bypass with ICSI. If it's severe male factor, we can bypass with perhaps testicular biopsy. If it's complete azoospermia, if there's no sperm whatsoever, then we can bypass with sperm donation. Equally, the female factors. If there's, what are the problems? The usual problems are eggs or the uterus. The uterus can be sorted with so many ways now, with endoscopy, with surgery, with medicines, all sorts. Eggs, as Rosie Letts mentioned, even the quality of eggs can, to a certain extent, be improved by diet, but at some stages, there's not very much we can do. Then we do IVF. Then we do ICSI, we do like a specialized IVF. We do that a few times. If this doesn't work, or if the woman is over the age of 40, or if she's younger with ovarian failure, then we can use egg donation. So we move on to treatments. We don't expect, as somebody very clever said that, it's not my quote, that you can't expect a different outcome if you're using the same treatment. So we must be very well aware that if we fail and fail over and over again, we need to move on to the treatment. So we have sperm donation, we have egg donation. So this covers most of our cases, but even if that fails, then is the possibility of surrogacy. So it is a pyramid, and as long as the couples are prepared to take all the steps of that ladder to the top, the vast majority of them will succeed. So I think this is very important, and this is part of the education and the fertility awareness. Fertility awareness is also something that begins in a smaller age. As a gynecologist, and as many of my colleagues, they practice standard gynecology, they should be educating, and we should find the possibility to educate our patients, our couples, our women who come for a checkup, the men who come for a checkup regarding the fertility assessment. It's very easy to have a fertility assessment. It's one simple blood test, perhaps, a scan, and a sperm test. Those three tests that could be done within an hour altogether at a very low cost, they can give an answer by 90% of the cases of what's going on. And also part of the fertility awareness is the importance of the history, the family history, and the personal history. If somebody has endometriosis and they're in the late 20s, then they should be aware that their fertility is compromised. So the options ought to be discussed. And then there's the option of fertility preservation. There's the options of perhaps having earlier the children, and so forth. One final comment with regards to fertility awareness is the demographics. The demographics in Europe, in Western Europe, at the moment is absolutely terrible. We need a fertility rate of 2 to make sure that we sustain a population. Apart from France, there's no country in Europe with a fertility rate of 2. The UK has a fertility rate of 1.8, and that's even taking into account the immigration. And it's been recently in the news, I think it was last weekend, in all over the news, how the immigration has actually contributed in the increase of fertility rate in the UK. But this is still below the magical number of 2. So there is a massive problem. If a female goes to university, the chance of becoming a mother is reduced by 30 to 50% for some reason. Main factor is the fact that obviously she postpones motherhood to a later age. So fertility awareness and fertility education is part of our approach. Number 2 is preconception care, preconception holistic care. Preconception is all the stages of a female or a male before they become pregnant. And this is a magical time in their lives, because this is the time where really everything counts. The level of nutrients and micronutrients, the quality, the health quality, and the health level at that time is so important for fertility, and it's equally important for a healthy pregnancy and a healthy outcome. The possibility of a child developing disease like cardiac disease or diabetes has been strongly linked with the maternal and partly the paternal condition, preconception. So we should be educated and we should be aware of that. And of course, preconception is also the levels of stress that need to be addressed in a holistic way, the levels of emotional disturbance that have to be picked up in a holistic way, and of course, nutrition and diet. Other factors such as smoking, alcohol, exercise, these are all part of preconception corrections in order not only to achieve a pregnancy, but also to have a healthy pregnancy and a healthy outcome. So fertility awareness and preconception are periods of an individual's life that need to be addressed as important. Sometimes just addressing the stress and reducing the stress should be enough for that individual to achieve a pregnancy without any medical input. And of course, the earlier this is done in the best of ways, the more likely they are to avoid any medical intervention in the future. I mean, I like to give the example that fertility is more or less like the fire. If somebody addresses a fertility issue at the age of 30, then it can be treated with a little bit of relaxation, perhaps, a very little primary, perhaps medical care, and a little bit of nutritional and emotional management. So it's the equivalent to a small fire that needs a bottle of water. You know, if the same problem occurs later on in late 30s, then they would need IVF. And even with IVF, they might not be successful. So as doctors, I think our aim is to educate our patients to avoid IVF if possible, to make sure that they bring their body and mind and spirit in such a level at an early stage so that they don't need our intervention. And this is part of the holistic approach. Part of the holistic approach is to make sure that they avoid seeing us at the end. Finally, essential fertility investigations. I'm pretty shocked when I see, I treat patients from all over the world, from many countries of Europe. Recently had patients from America, and actually from the US. We had the first success, and we're very proud of that. And I'm still quite shocked by the fact of how little people know about essential fertility issues, essential investigations. I don't think you need to ask anybody. Just go on the internet and find them. But blood test, which is called AMH. AMH is a hormone which is telling the women the ovarian reserve. It has a very small cost. It's only venipuncture. Some GPs might be able to organize it, but even privately, it doesn't cost an arm and a leg. And at the age of 30, you can see your fertility potential. So you can make your adjustments. You can consider fertility preservation. Or if you're engaged to be married, you might as well start trying before it's too late. So AMH, please Google AMH. This is an amazing hormone. It only became fashionable about 7-8 years ago. My team and I were privileged to be amongst the first ones to investigate it, and we were actually honored by the Royal College with a prize for research. We're very passionate about it. It costs as little as a meal, and then women, by doing this test, they should be able to know the fertility potential, both the natural fertility potential and the assisted fertility potential. So essential investigations for women, AMH test, one pelvic scan. There's amazing facilities all over the UK. You can ask a GP, but even if not, you can always go privately. There's amazing ultrasonographers. We were all taught by ultrasonographers. They're better than us in scanning. So you can pay a very small amount, as much as a meal in a good restaurant, and find out if your uterus is normal, if you have fibroids or not, if you have cysts or not on the ovaries, if you have any evidence of pelvic disease or not, and find that out early so that you can make your adjustments. And thirdly, if you have been trying with your partner for more than 6 months or perhaps a year, don't hesitate to have a tubal test, either by the standard traditional X-ray or by the modern fancy high-COSY new test, which combines scanning and high-resolution ultrasound, 3D scanning, and find out if the tubes are open. So AMH, pelvic scan, and tubal test should provide you with a diagnosis, with a fairly accurate diagnosis as essential investigation. And that should be widespread knowledge for everyone. In my opinion, they should be taught at primary school. And as far as men are concerned, don't be shy. Instead of having 2 pints of beer one weekend, go and give a sperm sample on Saturday morning, and then by Monday find out if you're fertile or not. I think it's very important for you to know whether you're 30, 35, 40, or 45, especially if you are considering of becoming a father at some stage. So I think these are my secrets. I took 2 more minutes on this session. Thank you so much, and looking forward to listening to the rest of you.
We'll allow you an extra 2 minutes. That's fine. I think the key there is awareness, and education is key, isn't it? And I thought it was interesting how you kind of sound like you're going to be out of work soon if no one needs IVF. But that's the ideal, isn't it?
I would love to. I'll be full-time AlphaZita, Sarah.
Yeah.
I would love to do that.
It's the idea of bringing back to balance, isn't it? Which is what we're all talking about, and that's the idea. And if you do need IVF because of age, because of any other qualities going on, then at least you're in a balanced place ready for that treatment. So yeah, a really great approach to hear. So thank you very much. It's been so good to hear from all of you so far. Now I'm going to introduce you to Dr. Kannelina Bimpa for the first time this evening, who is going to talk to us about something very special, a special invitation for all of our listeners. So I'll hand over to you, Dr. Bimpa.
Thank you so much. Good evening, lecturers, the lovely AlphaZita team, and good evening to all of you attending this very interesting webinar. What is interesting is not just the context of your lectures, but the wonderful combination of all available knowledge, treatment, and therapies, and all this addressing fertility issues. I might as well try to share. Please guide me, Sarah. You
have the slides?
We will try, yeah. We will try to... is that okay for everybody?
And then bring your slides into the middle. Yeah, fantastic.
All right. Okay, just, to have something to look at next to our faces, maybe. So one can only benefit from sharing options and experiences. I'm not a fertility expert, as you know. I'm a breast surgeon. And I must admit that this unity of fertility experts amazes me. This unity, this team, came together under the name of AlphaZita, which means fertility from A to Z. It offers its services in an organized fertility retreats. This way, we can all get together and experience the positive effects by exploring our options. I will try to change it into something else. So, something went wrong? No?
Sharing your screen.
I'm getting better, I see. Or not, Sarah?
Yeah.
Can you see that?
Yes.
We can.
Yeah, we can share the same. So the forthcoming retreat is organized in a 5-star summer holiday resort in Greece. And please visit the AlphaZita website to have a real picture of the event venue. During the retreat, the people attending will have a half day of lectures from the lovely team on these subjects and hands-on experience of the relative treatments. There will also be time, of course, to enjoy the resort, which is a beachfront resort of unique beauty. I'm not sure, is it possible, Sarah, please, to share the short video you have prepared?
Absolutely, I'll get that ready.
I'm not going to talk during the video. I will talk after it.
Sure. Just a very short mention that this is a video from a previous retreat that was held in Nicopolis Hotel in Thessaloniki.
AlphaZita, A to Z, is a team of true holistic fertility specialists. Doctors, scientists, acupuncturists, nutritionists, fertility massage specialists, fertility coaches. We treat patients in a unique and individual way as a team because we feel that fertility patients, like any other patients, are unique and we treat them in a true holistic fertility way.
So a fertility retreat is an amazing experience. It's an opportunity to come and meet therapists, bringing a fusion together of complementary medicine with conventional medicine and fusing those two together. And it's the opportunity to spend a couple of days with all of the therapists, all being one, all communicating, all connecting. It's a life-changing experience.
The benefits of holistic fertility coaching are multiple. We at the AlphaZita team, holistic team comprising of conventional medicine doctors, complementary medicine practitioners and different therapists, are pulling on our knowledge and expertise to help all our couples on their fertility journey. The education is key for our patients, and as long as they know what therapies are available and what is in the field of fertility help for them, they will be more reassured, they will be more relaxed, and we will be there every step of the way of their fertility journey to help them achieve their goals.
By adopting this holistic approach, couples can lay down the foundations not just for conception, but for healthy, uncomplicated pregnancies. At AlphaZita, we care about every aspect of your physical and emotional health. And so as we teach you to restore balance in your bodies, you'll notice that your general health improves along with your fertility, and you'll be able to carry these benefits forward with you for the rest of your life.
I think the experience is something very different from what we have in the United States, that they take this holistic approach and they look at multi-facets. And instead of just looking at the medical and the technical and the clinical, they focus on spiritual, the nutrition, with acupuncture, with all of it. So I think it's a much broader approach, and it makes you more appreciative of the experience that you've had. That's the big difference, I think, between this experience that we've had here at AlphaZita versus the experience we've had in the United States.
My experience has been like fantastic. It's awesome. I had no expectations because I didn't really know what I signed up for. You know, from the US, I just saw it online and saw Fertility Retreat and thought, oh my gosh, that would be so much fun to go to. And the people here have been so welcoming, and all the treatments that we got have been amazing. And I feel like I've just made like great friends for the rest of my life. So it's been awesome.
So no worries, you didn't see Sarah Holland in this video, but I promise you she's gonna be here in Greece, in sunny Greece in October. So we all wish to see you at the 11th of October in Sunny Resorts, and would like to thank you for your participation with some offers for those of you who decide to join us in Sunny and book within 5 days from now. The offers, I'm gonna read them so I won't forget any offer. We start with a discount of £100 for singles and £150 for couples. A 15-minute medical consultation prior to arrival, so the medical consultation which is included in the retreat is gonna be more focused. So might as well take advantage of that. Claire's Pink offers a self-help online fertility massage program, wow, worth almost £80, plus the visualization package. Sarah Holland kindly offers the online fertility EFT session to work on key emotional aspects of your fertility. That's worth £150. Rosie Letts offers the Fertile Body Guide, complete with recipes and a 30-minute introductory Skype consultation. Wow, guys. That's very generous from all of you. So thank you. What a list. Thank you for the generous offers. And they all reflect your dedication and your support as caregivers. So take advantage of the offers and have a look at the retreat venue in October, the 11th. See for yourselves what you don't want to miss. Hope to see you then. Thank you for attending this productive fertility webinar. And I must say I really enjoyed it. Thank you.
And we're not quite finished yet. So thank you so much. Thank you so much for sharing.
I don't have any time left later. So I'm aware of that. So I have to thank everybody now.
I don't want anyone to leave just yet, because we have some more to share.
No, nobody's leaving now.
Oh, wonderful. So yes, so the website, that if anyone is interested in not only learning more about the retreat and exactly what it includes, the dates, the pricing, but also then applying to come and meet us all in Greece, that would be to www.alphazita.com, which we will email that out to each of you that are registered as well, so that you can easily find that. But that's Alpha, spelled AlphaZita.com, AlphaZita.com, and you can learn all about this amazing retreat that we are all so excited to be taking part in. Because there's only so much that we can share, isn't there, here online, at a distance from all of you, in just short 90 minutes. You know, we can try and share as much as possible, but then to be able to actually spend time together in person in a more relaxed environment where you can speak one-to-one and get our personal support is invaluable. So I hope that appeals to some of you, and we look forward to meeting you. Before we finish up, I want to just give everyone who has spoken this evening chance to say one more thing that they feel they would like to leave you with, whatever that may be, whether it's some words of inspiration, some final thoughts, some advice, some guidance. I'd love to go through again in the order that we presented and just give you all an opportunity to speak to our wonderful listeners who have stayed with us this evening and stuck with us through our technical difficulties at the start as well. So Rosie, let's start with you. What would your final words be to all our lovely listeners?
Thank you. Yeah, I think what I'd like to say is that fertility, infertility, subfertility, it can feel completely overwhelming and daunting, and like you're on a bit of a negative spiral sometimes. I think it can be really hard to kind of think positively about the situation that you're in, and with nutrition, but certainly with nutrition, but also with all of these other approaches, I think the key is just starting, doing that first really positive thing to help yourself. And what you'll find is that small changes can actually have quite a big effect, because just doing something little, like listening to an affirmation track, or doing some tapping, or doing one of Claire's kind of self-help visualizations, eating breakfast when you don't normally do that, just that sort of small action can lead you to feel that much better and that much more kind of positive, and prompt you to take another small action. And then you find you feel a bit better, and you might take another small action, and before you know it, that's how we start to turn things around. Those little steps that we can take each day to work towards a positive outcome. So that would be my advice. Is just start. Just do that first thing, even if you can't necessarily imagine how things are going to look right at the end. If you're not quite sure how you're going to get to your final destination, start. Just take that first step. And you might be amazed at how the journey pans out.
Fantastic advice. Thank you, Rosie. Claire, let's move on to you.
I think that the thing that I've learned the most from my clients over the years are how valuable having a team that fully supports you, just how valuable that is on your fertility journey. And what I love about our AlphaZita team is that we have a really strong connection as a team. We're all pieces of a puzzle, and we're all needed to make that puzzle complete. And because we have such a strong connection, and we feed back amongst each other, and it is about us working as a foundation, as a really strong team. That's the most valuable thing, that anyone who's thinking about coming along on the retreat, or thinking about just working with us as a team, I think it's something that they should really take on board and really, really kind of think about. Because often, I know I see clients and they have an acupuncturist here, and they have a nutritionist here, and they have their people all dotted around, but they're not all communicating. When we communicate, we are much stronger. And I love magic, so I'm going to finish with, when you bring the wisdom from the medical people and the wisdom of the natural profession, that we create magic, and we really will and do.
Oh, Wonderful. Thank you, Claire. That was lovely. Gordana, I'd love to hear from you as well.
Right. Okay. Well, what I'd like to say is for all of you sort of on a fertility journey, struggling little, struggling more, or anything in between, if you want to become a parent, you will. There will be a way for you. You will find a way to become a parent. So the journey, as Rosie mentioned, can be from starting very small steps, just getting that start, through to working with different people and different specialists, what Claire said. But ultimately, what I would say, working together is great, but there is so much that you can do as a person, as a family, with our support and with the right frame of mind, bringing your body into balance and bringing your emotions into balance. You will make it. There are so many ways, as Dr. Sakos was mentioning in his talk about the holistic fertility and the approach of educating and getting you there through finding right information and doing right testing. I mean, all of that feeds into you becoming a parent. You want to become a parent, you will become a parent. It's a question of time. It's a question of how you're going to get there. And we sure know how to get you there as a team. It's a fantastic opportunity to work with such a team. Again, I have to stress. And the value to you as a patient, as a client, as somebody who needs our support is absolutely incredible. Never forgetting how much input you will have through learning, through knowing what to do and cooperating with us and sort of trusting us to get you there. But the work is together, not just us as a team, but it's with you, giving you this sort of, a control over what your situation is. And when you want to become a parent, you will. There are different ways, but you decided and you're going to get there. It's just that everybody's route is different. But I fully believe in that, and I've seen it happen for, as I said, to nearly everyone that came to see me. So I know that this can work and this will work. So you want to be a parent, you will be a parent. It's just a question of time.
Mm. Thank you, Gordana. Oh, how do I follow all of this? It's amazing. So, I want to pick up on my words. I just want to pick up on a few themes there. I think we're in a very unique time right now in the age that we're all living in. Yes, there are more apparent fertility issues than ever before, mainly because, as Dr. Sakos was saying, women are more educated now, maybe delaying motherhood till later in life. So there is a natural kind of expansion of fertility issues related to age, but other, environmental toxins, who knows what else is contributing to fertility issues nowadays. So we may see that there are more challenges, but at the same time, we're at this unique time when there are much more opportunities than ever before. Yes, on a medical perspective, so many other ways to approach fertility, so many different treatments that weren't available for our parents or our grandparents' generations at all. They wouldn't have dreamed of the kind of fertility solutions we have now. And also we have this wonderful knowledge and connection with the holistic, the natural, the integrated side, which again, a generation ago in medicine wasn't happening at all. This is very new and exciting that these worlds are coming together, and we're able to look at solutions in such an integrated way and much more potentially successful way. From a mindset perspective and emotional support, I'm thinking of all of you out there watching this webinar, taking in lots of information, and I really don't want you to feel overwhelmed. I don't want you to feel like there's too much to do. I want you to know that you have the strength within you to make really good decisions, the clarity within you to move forward and know what feels right for you. And the support of the team, as Claire was saying, is vital. So however you build that team, obviously we'd love for it to be with us. We'd love to support you, but however you build your team, make the most of that and use the support that is there for you, because I believe in every single one of you, every single person on a fertility journey, that you do have the strength, the resourcefulness, the creativity to find a way to make this happen. And we'd love to be by your side as you do that. So thank you very much for joining us. Our last words as well from Dr. Sakos. Do you have some final thoughts for all of our wonderful listeners?
Sure, absolutely. I would like to be optimistic as well as the rest of you. I have been fortunate enough to be practicing many years. When IVF started, when I started my IVF training, my fertility training in the early 90s, we were working on 15 to 20% success rate. Now clinics quote success rates of 40 to 50%. And as we all know, science and medicine has improved. However, now that we've reached to that level, then it's time to look at the other quality issues and the holistic issues, and time to address the experience and the quality of the journey, as well as the success rates. So the message to all of us, to all of you listening, is that you're not alone in this journey. You have some amazing people everywhere. There's some important people to be able to be your family, to be able to support you and nurture you during that amazing journey. From all the patients in the world, fertility patients, in my opinion, are the more privileged, because by definition, a patient is trying to promote health and prolong life, whereas a fertility patient invariably is trying and eventually achieving to produce life. And let's see that as a privilege for both from both points of view, from the patient's point of view, but also from our point of view, to be able to share this amazing, amazing creation of life. So you're not alone. Keep going. And as Gordon has said, the majority of patients, the majority of our couples, our singles, are the courageous people. They do succeed. So don't give up and keep going.
Wonderful. What a wonderful message to end with. It's been a real pleasure to be the host this evening for such a great team. Thank you so much for all of us joining us for the session, but also especially to our listeners who have been watching and sending in lovely feedback now via the chat box, saying how much they've been enjoying it. If you have found this useful, if you found that you kind of feel aligned with the way we speak about fertility, it's pretty different, isn't it, from what you'll get from your standard medical doctor or a standalone acupuncturist, for example. We are working truly integrated here as a team, and if you would like to experience more of that, we'd love to invite you to Greece. As Dr. Bimpa said, all the details are available on the site: pricing, dates, the full package. You'll see everything. It's so comprehensive that is included, and we do still have some spaces remaining and would love to invite you. So that will be at alphazita.com. We'll send all the details to you via email as well. And thank you very much for joining us. I'd love to wish you all a lovely evening and say goodbye. Thank you. Goodbye, everybody.
Thank you. Goodbye. Goodbye. Thank you.
Goodbye. Bye.
Bye.